Good morning. Welcome to MagnaWave office hours for this Tuesday morning. Pat Zemer here with MagnaWave. We come to you every Tuesday morning to answer any questions that you may have with regard to PEMF therapy, health and wellness, how PEMF therapy deals and helps with that whole type of discussion, and answer any questions that you may have, whether it's about machines, training, maintenance, anything that it may be. We're here to answer your questions. So if you'd like to ask a question, simply text your name to 502-599-9722, 502-599-9722. Just text me your name. I will call you back, and we can have a conversation about whatever it may be that's on your mind. And a lot of times I like doing that because it allows us to go deeper into the conversation to get to all the questions that you want to have asked about that particular issue that you'd like to talk about. Or you can simply post your questions in the chat box here on Facebook, and we'll put them up on the screen and we'll be able to answer your questions, whatever they may be at that point in time. So this particular Tuesday morning is the first Tuesday after Derby. And there'll be many more Tuesdays after Derby as we get ready for next year's Derby. But as you know, the Kentucky Derby this year was contested, and the winner was taken down to 17th place, and a lot of conversation and discussion about that, and the rules in the United States, and the rules from state to state, and the rules that a lot of countries use around the world have certainly all been in discussion at this time. And so it's been an interesting weekend. The horse that won trained, or not won, but the horse that was taken down trained by Jason Service. Jason is a MagnaWave user and a MagnaWave customer, so that's interesting from that position, from that situation. However, if you have questions, simply post them or give us a call, and we'd be more than happy to approach that at this time. Also, there's a question up, I'll take a look at it. Also, we are in the midst of dealing with rules and regulations in the state of New York, and what our position is on those as far as trainers and practitioners are concerned with the use of MagnaWave. So is the question ready that we had?
Yep.
Let's take a look at it. Can you give me the protocol for treating nerve damage from arthritis in the neck? Great question, Jackie. Certainly, what happens with arthritis more often than not is you have a buildup of calcium, the nerves become involved, the cartilage becomes involved, and you have a lot of irritation, which results in the pain and the stiffness that you receive, or that is a result of arthritis. In the case of nerve damage, nerves are certainly very resilient tissues and parts of the body, and so when I talk about nerve damage in the leg or knee or hip, to where you have inflammation of the nerve and it's causing a lot of pain, it takes longer to get inflammation out of a nerve than it does to get inflammation out of soft tissue, and it's just the nature of the tissue and of the nerve. So when you're dealing with that and you're treating nerve damage in the neck, for example, from arthritis, I would treat as often as possible. I would treat at a very comfortable type of setting for 8 to 10 minutes, once or twice a day if possible, to work on that area to get the inflammation out of the nerve, to hopefully relieve the pain. Certainly you get rid of the inflammation, that limits the propensity for pain, and things are better. So the protocol would be to, and again, I don't know the situation of who you're treating. Certainly, if it's somebody that can be treated once or twice a week, you can get after it in that regard. Just understand it's going to take longer. If you could treat them twice a day, for 5 or 6 days, and then as necessary you can maybe get ahead of the situation. Nerve inflammation reduction is a slow process, but it's a good question, and that's what I would do. I would treat as often as possible. As we always say, treat as long as function continues to improve. So if they notice some relief after one treatment or 2 treatments, and then you continue to treat, they continue to get their relief, then that's what you're looking for, until you either totally relieve it or until you reach a plateau that's about as good as it's going to get in a comfort type situation. So I would do it as often as possible and as long as function continues to improve right over the area of discomfort with the butterfly or the paddle or something like that. Hope that answers the question and helps out. Anything else up at this point? I do have a couple of...
got one more?
Got one more, okay. Treatment suggestions for a Lyme's disease horse to be effective with MagnaWave each visit. Well, quite often when we're dealing with Lyme's, and the PEMF has been shown to be very helpful in relieving some of the issues with Lyme's disease. Now, in a person, quite often it focuses on an area, maybe in the abdomen, maybe in the chest or the shoulders or the back. It kind of focuses in on a particular area. And when you're dealing with a person, we've gone to those areas and treated the area of pain, the area of problem, to try to get better circulation, better blood flow through the area, and hopefully help relieve some of the issue that's there. And then an overall body treatment just helps the good blood flow and oxygenation for the full body. Same thing when you're dealing with an animal. Quite often it's kind of in a particular area, and it causes its issue there. Go to that area and treat, and then do the whole horse or the whole dog at the same time, in order to, again, what we're trying to do is get the body in a position for the blood cells to be healthier and stronger, to better do the job and fight the issues that are going on in the body. And so that's what we're looking for in that situation. But that's what I would do, is I would treat the horse, same thing. You would treat as long as function continues to improve. To treat the horse once a month with this type of situation that's chronic potentially, where you're not going to hurt, it's not going to hurt, but you're also not going to help as rapidly. So more is better in the beginning, not necessarily more intensity, although you want to treat at intensity that's comfortable, but more often is better to get the horse beyond that particular type of situation, along with any other dietary things that you may be doing to help the situation along as well. So a great question, and if we have more, they'll just put them up there on the screen for me, and we'll proceed from there. If you'd like to visit, just send me a text to 502-599-9722, and I'll call you back and answer your question. And if you call in, you'll get some MagnaWave gear that you might enjoy having to use for your refreshments, or use for jacket, hat, whatever it may be that will be comfortable for you. So, chronic post-concussion syndrome protocol. Well, certainly in a concussive state, you have inflammation, you have a lot of things going on, so you want to, basically what you want to the area of the head, the area of the concussion, good oxygenated blood flow, which will help the overall situation, and good blood flow in general. So that can be achieved in a couple of ways. If you treat the upper torso, the lungs and the upper torso of the body, you're going to better help oxygenate the blood that's going to go to the head, help fight the inflammation in the head, and help the body better heal itself from the trauma that it received. Now, you could certainly put the loop over the head and treat like this. If you rest the loop on your shoulders and let the signal come up and down off of the loop, treating into the area, same thing. What we want to do is help the blood flow to the head be as healthy and as happy with oxygen as possible, to help aid any situation that needs help in the head. It also, a lot of times in these states, certainly the circulation is important, but people get down a little bit because they're dealing with this type of injury, and just a sense of well-being that can come from this type of massaging effect or stimulation effect of the device can be beneficial from that regard as well. So again, I don't want to keep saying the same thing, but I would treat as often as possible. Certainly, when you're dealing with that situation, 2 or 3 times a week for the 8 to 10 minute type of session on the area. Could you put the coil directly on the head like we do with people that are suffering from some forms of depression, or people who have suffered from a stroke, and they'll work on the cognition part of the head, or where the injury was in the head, to again help oxygenation and improve blood flow, and potentially allowing the body to better heal itself. You could do that. You could, if you know the area, you could put a coil on there, very low, moderate appropriate type of setting to help stimulate the area. Certainly, it's always a conversation with the doctor involved, whether it's a veterinarian or an MD, the doctor involved in the situation, so they understand what you're doing and they support what's going on with your therapies that you're selecting to use on an integrative type of method of delivering the therapy. To that end, talking about integrative, as we're looking to see if we have another question, or waiting to get another question, is MagnaCon is coming up, June 12th, 13th, and 14th. Be a great opportunity. We're going to have a lot of speakers there. Certainly, Dr. Marty, other people are going to be there. Dr. Nye is going to be with us, and we're going to be covering a lot of things in all things PEMF, human, small animal. Large animal will be discussed. Verlinda and Dr. Amanda have another presentation for us this year. This, again, another bone healing type of thing that they've worked on with tremendous success, and they'll be sharing that information with us at MagnaCon. Also, Dr. Marty, as I mentioned, is going to be with us, and they just released his movie, The Dog Doc, at the Tribeca Film Festival to very rave reviews, and the people are really enjoying the movie, and we're going to have at MagnaCon a screening of the Dog Doc on Wednesday evening of MagnaCon, and Dr. Marty will be there. Tickets are limited. Admission is free to the movie, but tickets, there will be only limited amount of seats. So if you want to see that, if you're in the area, you're a veterinarian within 100 miles or so, or a doctor, and you'd like to see what Dr. Marty does as far as his years of integrative medicine, come join us that evening. See the movie. But please need to let us know so we have seats for those who want to view the movie. So Dog Doc, Wednesday evening at MagnaCon. It's going to be very interesting, and then certainly Dr. Marty will be there to answer any questions and cover information that you may have. So we're looking forward to that also. Also, is there another question? Nope, not yet. All right. Also, something that's now up, running, and available to you is the AoPP, the Association of PEMF Professionals. You can go, the website is PEMFprofessionals.com. That's PEMFprofessionals.com. You can go there and see what the AoPP is. It's a great research spot. It's a place for practitioners of many different devices, or PEMF practitioners around the country, around the world, to come together so they can be on the map together, so you can see where you can find PEMF professionals anywhere in the United States. So if you are a PEMF professional and you're watching this and you'd like to learn more, go to PEMFprofessionals.com, the AoPP, and check it out and sign up. We are supporters of the organization, have worked with them as they are rolling this out, and so we're looking forward to that as well. We're looking for the association, not we, but we understand the goal of the association is to help bring some overall understanding and agreement in the industry of what's going on with regard to machine strength, with regard to when it can be used or should be used. Just a lot of different things like that to kind of bring the industry together. And the industry has grown. When I became involved in 2002 with PEMF, a lot of people didn't have a clue what it was. And as we moved along, and then in 2006, 2007, moved into the area of the high voltage or the higher powered PEMF devices, there weren't a lot. There were a bunch, but there weren't thousands of them around the United States, and today there's thousands of devices around. But when you stop and look at it in any given community, you can pick a city, Evansville, Indiana, for example. There's maybe 2 devices in Evansville, Indiana, serving the human and animal areas of health and wellness, and so there's just a lot of opportunity out there for people to learn more about this, and that's what the AoPP is about, is to help bring some unification, understanding, and self-guidelines to the self-regulation to the industry. So that's what's going on there. Check it out, and you can join if you'd like to, and which will be helpful, because the AoPP, for example, the situation in New York with the veterinary board making some decisions on these machines that are not founded in the type of machine that it is and how it's used, the AoPP is stepping up and going to aid that process along on behalf of PEMF practitioners around the country, not just practitioners in New York, but PEMF practitioners around the country. So check that out. Let's see if we have a question. All right. Hey, Wendy, follow up to neck question. I got lots of human clients who have neck pain. None of my attachments get to the exact right spot. Will there be a smaller neck size attachment made in the future, like a small rectangular pad? Like mine's here, Wendy. We've been looking at that. In fact, on the drawing board for pretty quick development, I believe, is in fact a pliable pad coil that could work on the neck, could very easily work around a particular area to be applied. Whether it's going to be round or rectangle is what we're kind of looking at as far as producing that pad. But as we understand it, the manufacturers, the technology is there. The way to build the pads in a durable fashion and flexible, that, like, for example, someone when you talk about plastic surgery or an injury to the face or something, that you could actually mold the pad, if you will, around the face and apply an intensity that's very comfortable, yet covering the entire surface area for plastic surgery or injury repair to the face or wherever it may be, or to be able to get to the neck area very comfortably. We've looked at little pillows that you might want to have made to where the pillow, you just place it on the neck and there's a coil in the pillow. That's also in the discussion stages. There's a lot of ways to go and a lot of things you can do. What I'd recommend initially would be to take the large loop and squeeze it down like a hot dog and simply bring it around the neck like this, so you're doing the entire area of the neck, because it'll pretty well come all the way around front. And when it's narrower, it's making the signal go in that fashion. Very effective, and that's how we did it for years, because we didn't have other attachments. So all we had was the large loop and the butterfly. But that large loop is very flexible in what you can do with it. You can do the same thing, run it from the base of the head, for example. Again, form it like a hot dog bun or a hot dog, and simply run it right down the neck into the spine, and you can hold it like this, or you can maybe use a little Velcro or something, or wrap it lightly with like a scarf, and just hold it there and make it long ways. So there's a lot of things you can do, but certainly what you're talking about with a mat is kind of the way we're looking at going, that's flexible and comfortable to be able to be used in that fashion. Great question. Thank you for asking. Any other questions, simply post them to the Facebook page, and we'd be happy to answer them, or give me a call. I'd love to visit with somebody. Let's make sure we haven't had any calls. 502-599-9722, and you'll receive some MagnaWave gear. There was a question asked, how long after giving birth can I treat myself? Due in August, can I use my machine to help with postnatal recovery? Well, the first answer is to go to the website, take a look at the webinars, Elaine's health and wellness, women's health and wellness webinars. She talks a lot about how she used the machine postnatal for her recovery, and she started immediately after bleeding was, she had a C-section, but as soon as things were in place and not bleeding, she began her treatments immediately. And very effectively, the results were excellent. Aaron did the same thing. Aaron Hughes, our director of training, did use the same thing, and many people have used the device for comfort and health and wellness post birth and postnatal, and to very good results. And typically, again, as soon as things are stabilized, that could be 24 hours, it could be 10, whatever the situation may be. But you want to make sure, again, that there is no active bleeding, everything is in good shape, and the recovery process has begun. Then you can use this device to aid and provide some help to your recovery situation that you're dealing with through better oxygenation and blood flow. That's basically what we're doing. Great question. Thank you for asking. And let's see here if we have... Then there was a question about a dog losing a leg going out that was put up, and they felt that it was something in the back. What would be the best way to treat that? Well, certainly on a small animal, any animal basically, if they're having an issue like that where they're feeling that it's from the leg, we have the same issue. We have nerves in our back or muscles and things that are coming off, and all of a sudden our leg is just not working the way we want it to, or our arm, and so we treat the back. Quite often when we're dealing with people that have carpal tunnel syndrome, we'll treat the wrist and the hand, the elbow, the shoulder, and the back in order to get the whole area, because everything is going back to the spine. Everything is ultimately coming back to the spine, the neck, the head, and so we want to relieve those areas, and we don't know exactly where those are coming from. I remember Joseph had an issue with his hands and went to the doctor, or a carpal tunnel type of situation. He's a guitar player, and the doc said, you can treat all this, but we need to treat your low back. It's coming from your back and radiating to your body. And so same thing, a small animal that's having those types of hip or leg issues, certainly treat the spine, and you want to treat them comfortably. You don't want the dog bouncing off of the mat or anything, but you can give them energy. Because they're smaller doesn't mean that they won't accept, or the energy is not beneficial to them. So you can give them as much energy that is comfortable. If they're uncomfortable again, they'll move. If you're turning the machine and it gets to a level that it is uncomfortable for them, they will move. Whereas a person may say, I can take that. We don't want a person, I can take that. We want a person to be comfortable. We want the same thing on an animal. Where the animal can't talk to us, the animal can move and will move away from you or look at you in a manner. I always gauge that on a horse. People are saying, oh my gosh, that's a lot of energy you're putting into the hip, getting a lot of movement. That's got to be uncomfortable for the horse. And I say, look at the eyes. If the eyes are comfortable and the horse is relaxing, and maybe the horse is releasing, or maybe then he's fine. He or she is fine. And so you really can't always equate it to the intensity, but the eye will tell you 99% of the time, or they'll look around at you and say, turn it down. So you just have that type of thing. So that's the situation on the small animal with the leg problem. And I would treat, a couple of times a week, and again, very universal protocols. Treat daily, 4 or 5 days in a row, 6 days in a row, and then as necessary to maintain what you've achieved. And if you have a situation and you treated 4 or 5 times, 6 times, and then you treated once a week and everything continues to improve, then you're good. Maybe it's going to take 2 times a week to stay ahead. You have the same thing as a person. You go outside and do too much work and your low back is sore, and you treat yourself once or twice and you're better, but yet you go back out and it's still there. You might have to stay with it a little bit to stay ahead of the situation that we're dealing with. Any questions come up at this point that people may have? Okay. How many viewers we have today? What are we up to?
24, 25?
24. Gosh, just 24 more and we might give away a machine. But if you have questions, simply put them into the chat box or send me a text, 502-599-9722, and we'd be happy to converse and talk about whatever it is that you'd want to talk about. Certainly a lot of things going on around the country that legislatively that we're the AoPP, and we as being members of the AoPP are certainly supporting the action that they're taking, and to help support us as practitioners, and you as practitioners to help support the industry. So check out the AoPP. Again, let me see if I've had another question here. If you're a practitioner and you have a question, someone asks a question, one of their plugs on their large loop is not working, what should I do? Call the office, 502-742-7868. Give the office a call, talk to Lee, and you might want to send us a picture so we can see the plug and make sure that it's in good shape, and it could be that there's something integral on the machine that needs to be looked at, but call the office and we'll take care of those questions and answer them for you immediately. So okay, here's a question. Are you supposed to keep the mat flat? Can you basically fold the mat or whatever? Well, you don't want to fold the mat in half, certainly. But can you mold the mat if you want to? I did it this morning. I treat myself every day, treat my my prostate area every day, and so I'll sit on the mat and run it up my low back. So I'm treating my low back at the same time as I'm treating the prostate area of my body, and so that you can do that. You can take that mat and wrap it around an arm if you wanted to, or wrap it around a leg to do the full upper body part of the leg of the mat. The mats are made in what they call an Archimedes coil, where it starts in the center and comes out to the edge of the mat with maybe an inch between the rings. The paddle, on the other hand, is woven in the same fashion, but the coils are touching as it's woven. That's why the mat puts out a little more intensity as it is applied. But you can, the mat is flexible, the wire is adhered into the mat from two different directions, so in theory it's not going to come apart, fall down, or anything like that easily from that use. And so the mat is flexible, and it's designed to be flexible. Very good question. Any other questions might be there?
You got one?
Hi, Brittany. Some clients think that bounce in the muscle while treating a horse means it's sore. How do I explain that this reaction doesn't set, well, or am I wrong in my thinking? Okay, great question. And what the device does is, as you can do two things. You can take the device and you can turn it up to a level that you have a visible mechanical massage taking place over the body. So you can turn it up and move it over the body and have physical pulsing or visible pulsing going on all the time, everywhere. At that point, it's certainly not showing us any sense, it's not marking areas of sensitivity for us or showing areas of sensitivity, because we have it at a state that we are basically massaging everywhere. When someone massages, you have tissue movement every place that they massage. We can do the same thing. You can turn it to a level that you have muscle vacillation as you move across the body. Now, that you get it in the shoulder doesn't mean you're going to see it on the leg, because there's not as much tissue in the leg of an animal or a person even that you have certainly in the back or the shoulders or the mid-back, that type of thing. So now take it to the other direction, and what I always talk about in our videos and in our training that we typically do, we turn it to a lower type of setting and scan the body, and what will happen is areas of sensitivity will show. Where there could be some sensitivity in the area of the animal, or a person will say, wow, I feel it right there. It's right there on my shoulder. And so they'll feel it more in that situation. But a person, because there's not as much muscle tissue like there is on an animal, will not necessarily feel they'll feel the pulsing, but you won't necessarily see the pulsing until you adjust the signal accordingly. So to use the device to look for sensitivity, is what it'll do, and it'll show areas that are sensitive. It won't tell us why they're sensitive or how to treat them, because we're not doctors and we're not using it in that fashion. It just shows, just like if you did yourself, well, it's right here in my low right hand side of my back where I twisted yesterday doing this or doing it, or skiing or whatever it was that someone may do. So it helps you see those areas of sensitivity. So if you've got it turned up to where you are getting movement everywhere, then that's exactly what you're doing. But if you're doing it in a scan, then it will show areas of sensitivity. We don't talk about soreness because we're not veterinarians. We don't have, again, where it's coming from, is it referred, all those types of questions. Is it something that was a result of something anatomically in the animal? Is it something that's a result of diet or whatever the situation may be that's causing the animal to have issues? That's all certainly, animal or person, that's all certainly doctor-related type of information. But again, you can scan a horse and find areas of sensitivity, or you can turn it and overall massage an animal, or basically mechanically stimulate an animal for comfort and better sense of well-being and better oxygenation and health and wellness. All right, anything else on board there for a question? Taking a look. Okay, it'll come up. Let me see. Got one? All right. Kate, Do we know how many of the Kentucky Derby horses were using MagnaWave or other PEMF? I know MW sponsored Win-Win-Win, but would like to be able to tell my clients how many others were using it as well. I did a quick, I went over the horses in the Derby, and what I have to do is be totally transparent here. While I'm not in the horse's barn and I'm not dealing with the trainer specifically on all of these cases, I'm able to ascertain which trainers use our devices or even someone else's devices to treat their horses. And the best that as I looked at it in this Derby, there were 10 horses that were using PEMF therapy, or their trainers used PEMF therapy as a regular process for their care of their animals and wellness and so forth. Can I say specifically that this particular trainer used this particular device on this particular horse? I can't really say that. Although we do know there are several of them, we know who was treating various horses, but I would say that 10 trainers in the Derby actively use PEMF therapy in their day-to-day operations for the health and wellness of their horses. Certainly Win-Win-Win we were doing, and we'd hope for a better result there, but you know, things go as they may. The horse that was taken down, the services have used our stuff in the past and have been customers, and so that, you know, we can look at that type of situation. And of course we know practitioners on the backside who were treating specific horses in the race. But for conversation's sake, I would say 10, could be 12, but that's typically where we land each year. It looks like there's 10 to 12 horses in the Derby that are utilizing the processes for the health and wellness of their animals. Good question. Anything else there that we have to come up? Take a look at it.
Yeah, we have one more.
One more, here we go. Oh, it's a long one. Carly, I recently treated a man with shoulder pain, comfortable setting for 6 to 8 minutes. He felt pulse going straight through his arm down to his fingers. The next day he had more pain down his arm. I explained that MagnaWave chases the pain, and there are muscles, and there must be sensitivity that is being brought to the surface. Is there a better way to explain what is happening to my client? I don't want them to get discouraged after one treatment. Well, sometimes, and it's a great question, sometimes you'll wake something up, you'll approach a situation. What I've had, the brain recognizes basically one pain at a time. Now you may have pain all over, but where's it hurting? Well, it's in the knee, or it's in the shoulder, or it's over here, and where you may have pain in more than one place. I can kind of equate this to racing jockeys. As a matter of fact, when I first started in the business and with this high voltage equipment, I would treat athletes or people that had pain, and I would deal with some jockeys and riders, and the question would be, they'd come and say, boy, my low back is killing me. Can you help me with my low back? So we'd treat them, and they'd say, boy, I feel better and it feels looser. And the next day they'd come back and say, now my shoulders are driving me crazy. What'd you do? Well, basically we relieved the one, and now the other one kind of comes to the surface as the predominant pain. So you can have that, and this goes back to my conversation I was having about carpal tunnel. You can have your pain here, but it's coming from back here, or it's, you know, vice versa. It's here, but it's going back here, and now it's bouncing back and forth. So someone could have pain in their shoulder, and you treat their shoulder, and all of a sudden now their elbow and their wrist are there, that you need to work on those areas as well. To treat an area and have something else all of a sudden pop up is what can happen, and that's how the pain processes quite often work in the body. So I would simply treat just as you did, but I treat the shoulder and the arm again to see what is there and to help relieve the overall situation. Great question, though. Appreciate it very much. I hope I was clear enough. If not, give me a call and we can discuss it a little further. Send your name to 502-599-9722, and I will be more than happy to ring you up and have a conversation that you would like to have with regard to PEMF therapy. Okay, let's see. If you want to get education, if you're new to PEMF and you're new to this particular broadcast and you'd like to learn more, while we put a lot of information on the MagnaWave corporate page, you can't search that page. But if you go to MagnaWave International PEMF Education and Resources is a group, and you can go into that group and you can search for information that's there, and it will pull up answers that people have given and pull up situations that have been shared by our practitioners and other people with regard to PEMF therapy. So you can specifically search terms in a group and get those types of posts. Also, you can go to the AoPP website, the Association of PEMF Professionals, and the website is PEMFprofessionals.com, and you can search for various studies that have been done over the years with PEMF and how it's been utilized. You can see where practitioners are around you, so you can answer and get a lot of information covered from the Association of PEMF Professionals page, website. So there you go. Any other questions? Can you MagnaWave over a standing wrap? What if the wrap is a sweat wrap or Budavet? The question is, yes, you can MagnaWave over a standing wrap to help the circulation and help the blood flow in the area that's being used. And a lot of times when we've talked about this, and there's, as things develop, we get different schools of thought. When something is producing heat, for example, it's improving the viscosity of the blood in the area. Now, if you bring something along like MagnaWave for movement and blood flow to help move that area and help deal with heat and MagnaWave at the same time, back in the day, and we still feel this, that if there's something hot, if your hoof is hot, if a horse's hoof, or if you have heat in your shoulder and you apply MagnaWave to it, it's designed to help cool the area and help the blood flow in the area to cool the heat related to the pain or discomfort that someone is having. And so we've and same thing, if you're talking about a horse and there's inflammation in the foot or there's a temperature heat in the foot, will treating that area help the blood flow in the area and to help cool the area? That's our design. That's what we want to do by improved blood flow, is to help those types of areas. Now, if you have a wrap, and the idea of the wrap is to produce heat, to sweat the area, to get the flow going on in the area, to use MagnaWave at the same time will help that situation along as well. Now, if you want heat and you don't want cooling at all, or any aspect of trying to move the blood flow through the area, then you don't want to necessarily MagnaWave at the same time, because the MagnaWave in a form by oxygenation and blood flow works to cool. But if you're heating it up and you want to move it, to use MagnaWave as a pulsating device to help move things and improve that area, then there certainly is an application as a complementary type of application. Again, that's a discussion that you want to have with the professionals involved with what you're dealing with. If you want to discuss that, 502-599-9722. Any other questions on the board at this point? Nope, everything's quiet. All right, let's see what else I've got here. The standing wrap question. Let's see, buffalo hump. I'm not exactly sure what they're describing, but we can get to that. If you have a question, simply put it on the board. We'd be happy to answer it. Let's see, we covered MagnaCon Association. MagnaWave is a member of the Association, American Association of Drugless Practitioners. Well, now here's somebody calling. Let's see if I can just take it. What I'm going to do is I'm going to call Brittany back. Let me do that. Okay. Here we go. Let it, hopefully Brittany will be able to answer.
Hi, Pat.
Hey, good morning. How are you?
Good. Thanks for calling me back.
Yep.
I had a question. I got recently contacted by a potential client, and she was asking about if the MagnaWave can help an abscess in the horse's eye. She thinks it was caused by bacteria, and I couldn't really find much research on that, so I was wondering what your
Well,
thoughts would be.
I don't know if you'll find absolute research on that, but certainly an abscess is an inflammation. There is stuff going on there that you want to deal with. To put the butterfly near the eye on the horse and help the overall circulation to the area and oxygenation, just as it does on a hoof or any other place where you could get an abscess type of growth, would certainly be beneficial. If it's bacteria related, I'm sure they're using maybe an eye wash or something like that, or HydroWave could be applied to the eye to help the area around and behind the abscess. But certainly to treat it would be something that could be addressed, yes. If they're concerned, they might want to ask their veterinarian, but again, it's been shown to be very beneficial to reduce tumors, the size of tumors, which is not an abscess, but it is a growth. It is something going on, and you want to take away the inflammation and reduce it. So to approach that from the idea of better oxygenation, better blood flow, inflammation reduction, allowing the body to better heal itself, most certainly.
Okay, and when I do work on it, would you suggest that I do it on the low setting so that no pulsating of the eye muscles? Those are very delicate muscles, and
they are, and you know, again, you don't want to put that on to where the horse is doing this when you're treating the eye or the head. But could you could you put it on and you see the eye just barely twitching, and the horse being there comfortably? That's okay.
Okay.
You want to get good stimulation to the area. Do you have to do that? No. Put that coil on there, put it at a low setting, and let it run for 10 minutes or so. But if you really want to massage around the area, if you will, or stimulate the area, if there's a little twitching, I mean, just ever so little twitching in the eye, as long as the horse is comfortable and appearing comfortable, then you're okay. Certainly you don't want to turn it up to where bang and, you know, the horse is doing this. That's certainly not necessary, like you might do on a knee or a foot or something where you really want to get after the situation.
Okay. And one more question.
Okay.
I had a horse that was just receiving eye surgery. She was getting an eye taken out, and they were closing up the eyelids. Would you suggest waiting just 2 or 3 days before I started MagnaWaving her eye as well, or just as long as there's no, you know, bleeding? Of course they just suture it up and it's closed. How long would you suggest I wait?
I would say if you're confident that the bleeding is not there, you don't want to have conditions from bleeding, but at the same time as it's healing. So if you're beyond bleeding and hemorrhaging and you want to very lightly treat it to reduce any potential scar tissue, to reduce any discomfort that could occur in that area, the sooner you get after it, the better your result is going to be. If, for example, if you waited a week and they came back and say, well, there's some discomfort and there's scar tissue there and it's building up, you're not going to necessarily erase the scar tissue that has occurred, but you can keep the scar tissuing and the scarring at a minimum on the inside. So a very comfortable treatment to the area as soon as bleeding and everything is in control. A doctor may very well tell you to wait 24 to 36 hours before you do that, and but at that you're certainly safe at that point. But again, like I say, if someone sustains an injury, the quicker we can get after it, the better the result and what we're looking for.
Yes. Okay.
All right.
All right. Well, thank you. That answers
You're
my
welcome. Now
question,
send an email to send an email to support@MagnaWavePMF.com. We'll get you some gear.
Okay. Thank you.
Okay, Brittany. Thank you.
Bye-bye.
Bye-bye. Great questions about how to utilize the device for various purposes around an eye, and it applies the same way. If someone if a person or a small animal has something going on that requires surgery around the eye, or they're having an issue with an abscess or a tumor or something like that, you can certainly approach those areas, work for reduction in size, and to aid the processes that the professionals are putting in place for their healing aspects. Okay, any other questions? Give me there it is. There's one. I got another one over here. I have a client that's treated twice, and she's developed excruciating knee pain and said that she had the injury 50 years ago. would this be a case of detoxifying of that tissue around an old injury? Well, that's an interesting question, detoxifying the issue. Typically, to detoxify, you're going to detoxify the whole body in the area. Now, if there's a lot of tightness and old pain and discomfort around a 50-year-old injury, and you're going to come back and start treating it for the first time, there's going to be things going on there with regard to their flexibility and how they're feeling. That you're going to have to deal with. Had situations where I'm going to come back to an animal. You treat an animal and you want it to be calm, but because the animal is feeling better, it gets more active. Or I've had people say, "Well, what'd you do to my horse? He's fresh." Well, your horse doesn't hurt for the first time in a long time, and so they're going to be happy and fresh, if you will, in some instances. So in a situation like that, a 50-year-old injury that you're dealing with, you're not going to get reversal in one treatment. You're not going to. It's just not going to happen. But in subsequent treatments, and someone has to understand that there is a process here that we're going to have to go through and deal with. But if you're relieving some inflammation in an area and all of a sudden they're walking on it more immediately, then they might feel some different pain than they felt before, because it's not locked up, if you will, or stoved up because of the inflammation. You reduce it, they start to move. Oh, that's hurting me. So you need to just be patient and continue to deal with the situation. But certainly detoxing the area and detoxing the body can be beneficial to that situation as well. Okay, do we have anything else, any other questions that are there?
No.
Okay, practitioner in St. Louis, someone's looking for. I'm not going to, can I get on? And I can't get on the backside. Lori asked a question, wondering how I can get hands-on. I wonder why it's ringing today when I'm getting messages. But let's dial it up here. Okay. So maybe that's just somehow the phone is, we're dialing. The phone is ringing when I get a message instead of bing. I got that figured out. Yes, ma'am, you have a question?
I do. It's about the mat.
Yes, ma'am. You there?
So, hold on.
Okay.
Yes. I have to mute my computer. Okay, so a question about the mat. If I have somebody laying or sitting up against the mat with it on their back, there's a significant amount of lead as well between the machine and the mat. Can I make a coil out of the lead, and will that provide a treatment frequency as well?
Yes. In theory, you've only got 2 wires in the lead. That's the challenge. But if you wanted to create a circle and maybe wrap it around their knee, they will be getting energy to their knee because you have created a circle in that particular area of the mat.
So you close the connection.
Yes, that's going to work to do that. Are you going to feel it like you will with a coil that's placed over the knee? No. But are you, and you'll see that a lot of times, cats, if the coil is there, will go lay on the lead that is in a circle. They'll lay on that, or they'll lay on the lead just to receive the energy that's passing through the lead because they find that very soothing. But
right.
So
okay, great.
Yeah, but in essence, you could do that. Yes. Great question,
great.
By the way.
Thank you so much.
Yeah. Anything else?
No, that's good.
Send an email to support@MagnaWavePMF.com and we'll get you some gear.
Thank you.
You're welcome. Thank you. Bye-bye.
Bye.
Okay, here we go. Let's see here. Is this the same? Different? Let's see here. Is that the one I just dialed? I don't know. That's the one I just dialed. And there was one coming in and I lost it. Well, if you retext, if you sent me it. Yes.
I've had a question asked. I saw, do they have to, when practitioners come to hands-on training, do they need to be certified on the backside to go to the track with us?
No. We take them in as our guest, if you will, to the backside. So you don't have to be allowed on the backside to come in for training with us or whatever you may be at this time. I mean, if all of a sudden somebody said, well, we don't want to, have this or do that, then, we'll deal with that. But no, if you're coming in for hands-on training and you've been through our training and you're getting into where you want to be able to do that, then we'll take you to the horses and experience what's going on with the horses. So, good question. Thanks for asking. Any other questions at this point?
I'm not seeing any.
Let me see here. That's been about 50 minutes. That's not bad. If you have a question, please let me know. If you have a question about MagnaCon, be happy to answer it at this point. Yes?
The itinerary for MagnaCon, the tentative one, is currently on the MagnaCon website if people want to go.
And how do they get to the MagnaCon website?
MagnaCon PEMF.com.
Okay, if you want to know the itinerary for MagnaCon, you go to MagnaCon PEMF.com, and that's the MagnaCon website, and you can see everything that'll be going on at this point, total schedules and how we're going to be doing things at MagnaCon June 12th, 13th, and 14th, coming up here in just not long at all, about 45 days it looks like. We'll be having MagnaCon 2019. It always amazes me, the people that come, the questions they ask, the stories they share, the information that they bring to the table with the professionals that are there is just amazing. And so if you want to learn more and understand this, then come on to MagnaCon and check things out. If you're a practitioner and you want to come and use it for your continuing education, you can do the same and spruce up your daily knowledge of PEMF and what is going on. Okay, let's see. Great. MagnaCon PEMF.com and for the full itinerary for MagnaCon. If you have any other questions, simply put them in the chat box and we'd be happy to answer them for you. Certainly if you have an Alexa, go to Alexa, look flash briefings, add MagnaWave, and you'll get our daily flash briefing, information, news, so forth from MagnaWave, and we're very happy to bring that to you as an educational, continual learning tool that you can use every day. Just go to Alexa, what's my flash briefing for today, and you'll get the current flash briefing presented by MagnaWave. All right, I don't see any other questions at this point. Again, if you want to come to, is there a question there?
Nope, it just popped up.
With archives, practitioner's website with advice. What was the practitioner?
AoPP.
Pardon me?
AoPP.
AoPP. PEMFprofessionals.com is where you can go to learn more about the AoPP and how the AoPP can be beneficial to you as a professional practitioner and help support the industry in general, if that's what you're referring to. Or there's the MagnaWave International PEMF Education and Resource Group, where you can go and search things by virtue of. And if you're a practitioner, certainly we have a private group, the MagnaWave Certified Practitioners Group, and where you can go in and ask questions of the group to learn and grow your practice or how you utilize the device for personal animal use or whatever the situation may be. Using it on your person, in your practice as a doctor, as a veterinarian, or as a practitioner using a device on small animals, large animals, and people. All that information and questions are available to you on the MagnaWave Certified Practitioners page. They are telling me that there are plans in the AoPP to have a forum on the website where people can go and do the same thing, ask questions, have discussions, so on and so forth about PEMF and how it can be beneficial to your health and wellness. Okay, I don't see any other questions at this point, so we'll move on for today. We'll be back next Tuesday to have more questions on the MagnaWave office hours. I'm Pat Zemer from MagnaWave. I'm glad to be here with you. Wave on to better health. Have a great day, great week, and wave on. Thank you.